Usually, when a patient sees a clinician and the clinician is suspecting an infection, they would ask them to do a urine culture test. Now, what happens in practice, despite existing guidelines, is that before the urine culture test results are out, the clinician would still prescribe antibiotics to the patient because they would suspect that they're going to turn out to be positive. In many cases, they actually turn out to be negative. So this means that the patient had taken antibiotics when they shouldn't have. And therefore, what we're trying to do is that we're trying to predict positive urine culture results using machine learning and using the patient's existing historical data in order to minimize this sort of rush decision to prescribe antibiotics to the patient. So in our project, we're trying to minimize the prescription of antibiotics using machine learning. The way we're using AI is that let's think about it as inputs and outputs. So imagine if AI is this black box that has some inputs and an output. And then what we feed into this black box is the patient's, let's say, vital signs, age, demographics, previous culture results. And then what this box would then produce is positive versus negative urine culture result. And the way we're using AI is that we're training the model to predict, to learn from existing patterns within the historical data of the patients in order to associate patient data with this outcome label of positive versus negative urine culture results. So we're using actually data from Cleveland Clinic Abu Dhabi. So it's all real world data from patients who visit CCAD. We're mainly focusing on the outpatient case. So we're looking at outpatient data, and there we're looking at like patient vital signs, demographics, and so on. But it's all anonymized real world patient data. So my hope is that if we actually do prove empirically that there is an over subscription of antibiotics and that machine learning has the potential to manage that or guide the process, that we would be able to push our model into practice, so push our AI system to actually be deployed in hospitals and also influence policy in guiding how antibiotics should be prescribed, because excessive use of antibiotics could lead to this huge already existing problem, which is antibiotic resistance. And this is quite a big problem, so we're hoping to solve a small piece of that puzzle.